We've had some news from the White House, a couple of executive orders signed by President Trump, doing his best to try to single-handedly dismantle the underpinnings of the Affordable Care Act, one of which is actually removing the funding for subsidies for potentially millions of people. I wanted to find out, as a small hospital, what do you think this effect will have on your hospital and other small hospitals around the country?
Yeah, it's a great question, Peter. And to be honest, I think at this point we don't know. I think the immediate effect could be that we see insurance providers that have been providing insurance to individuals on the exchange program either increase the cost of that coverage to those individuals or decide they're not going to offer coverage in the state anymore and limit choices. The effect on the hospitals is we're going to have fewer patients actually having insurance, and that means they have less access to primary care services and things that keep them well, and they'll end up having to come to the hospital when they're very ill, which means the emergency room. It drives up the cost of care for everyone. Plus, it often creates situations where serious healthcare issues could have been avoided for an individual person, and they weren't. So anything that reduces, access because there's no funding is a concern.
So let me ask you this: the president also opened up the avenues for people, or I should say, for insurance carriers to be able to cross state lines offering coverage. And I realize that you and the other hospitals in western Montana are where people will go to get the treatment that they need. How will that particular policy affect you?
Yeah, again, I don't know that it will affect our hospital. I think the concern with that isn't, the concept of crossing state lines with insurance actually, has some resonance. But the challenge is that there's actually a history of us having done this before. And back in 1983, we had the ability to have insurance across state lines with associations. And the challenge we saw there is that there wasn't anybody minding the ship in terms of what those insurance products were. So people were offering very inexpensive, easy-to-access insurance products, but the actual insurance product itself was not comprehensive. The coverage wasn't what people expected it to be. And so they would arrive at a hospital or a healthcare provider thinking they were well insured and finding out, on the contrary, that they were very underinsured. Best example I would give you would be, your insurance plan in the state of Montana, whether it's Allegiance or Pacific Source or Blue Cross Blue Shield, all of those providers have an in-network agreement with the helicopter services and airlift services in the state. So if you get in a car wreck on the Lolo and you need to be airlifted out, and you have Blue Cross in Montana, or you have Pacific Source, or you have Allegiance, you're going to be covered for that. That you may have a copay, it may come up against your deductible, but it's a covered service. On these cross-state line programs, there's no state insurance or a state auditor monitoring this. They don't have any authority to monitor it. And so they may say, you may be at a plan that says, hey, we'll pay up to $50 for your air ambulance services. And some people might take that plan thinking that that's what it costs, is $50 to transport somebody. And of course, it costs thousands of dollars. And so that's the fear that exists right now with this plan. And the devil will be in the details. But we do have past history as a lesson, and that lesson is we had a lot of less than stellar insurance plans being offered in the past with similar arrangements.
So, Dean, to your advice to folks, especially folks who are prone to visiting the doctor more often than others, how should they best protect themselves?
Well, I think the best protection, unfortunately, might be the ballot box, because the trending is to go back to individual risk pooling rather than, a more collective pooling. Because, the thought process that's driving this is that it's fundamentally unfair if you're a relatively healthy young person to have to pay higher premiums because you're in a collective with Americans or unhealthy Americans or people that are requiring higher degree of medical services. And so the executive orders that were signed allow now a pathway for people to access health insurance based on their individual risk, which for healthy people will lower their cost of health insurance. For people that have to see the doctor frequently, as in your question, their cost of insurance is likely going to go up substantially.
And of course, for those who with unexpected expenses, such as new moms with a baby that's in NICU for an extended period of time, who knows what could happen with them?
Correct. And these so-called association health plans, there's no guarantee that they'll even offer that coverage. So you may buy a product that you think is going to cover that moment, and it in fact doesn't. Again, because there's no regulation of those plans at a state level.
Now, is that, well, I guess I could ask Matt Rosendale if that's something that his office could mandate, before anyone's allowed to come into the state to offer those types of services.
Yeah, and that's above my pay grade, but just on the basis of what the intent of the executive order was, it appears that it's actually trying to keep that from happening. I mean, they're trying to create it so it falls under federal statute, not state, so that states, because as soon as you allow the state to regulate it, then it's not interstate anymore. It's not transportable. So it doesn't feel like that they're going to let the state auditor get involved, but I think it would go a long way to helping if we did allow that to occur.